Read is the founder and creator of the Caretaker's Garden, a natural healing sanctuary in Boonville, California, here in Mendocino County. Wendy's a highly skilled herbalist with a background in biochemistry and almost 20 years of clinical experience. Her book, titled The Emerald Trinity, Cannabis Therapy for the Mind, Body, and Spirit, published by Inner Traditions, is due out this year. Congratulations, Wendy. It'll be great to see that. Wendy Read, welcome to the Mendocino Cannabis Alliance and visit Mendocino County's Health and Wellness Symposium and to Dragonfly Wellness Center. We welcome you. Thank you very much.
Well, a big thank you to the Dragonfly Wellness Center for putting this all together and everybody else that was involved. I'm sure it was quite a big team. So I was living with a family in a tiny Mayan village on a beautiful Lake Atitlan in Guatemala. I was studying Spanish, teaching English, and helping the local curandera Maria collect herbs from the base of the volcano that was her back garden. One day, I was on the terrace of her cement block home doing dishes with a green bar of soap in the outdoor sink when a young girl in a colorful hand-woven traditional dress gracefully slipped by me. Inside, I heard her whispering urgently to the old curandera, telling her to come quickly. Her sister was bleeding. Maria grabbed her basket of herbs that was always at her side and called to me in Spanish to bring 6 roses from the garden. How sweet of her to bring flowers to a family in need, I thought. That's amazing. I was amazed at her quick thinking. I picked 6 roses using the hem of my skirt as protection from the thorns and quickly followed her through the village. Upon arrival, she was ushered into a room separated only by a hanging blanket. I waited outside. After some low discussion and an occasional deep moan, she came back out and took me to the kitchen. There she pulled a mortar out of her basket and a few dried herbs. She began to hammer the herbs with her pestle and told me that the young woman had just given birth and was bleeding profusely and we must stop the bleeding. Then she began muttering prayers in Tzotzil, the local Mayan language, as she continued to pound the herbs to a powder. Hot water, bring it, Wendy. And the roses. I did as she said. She moistened the herbs in the mortar and added the fresh rose petals. A little more hot water, and she had a pulpy, slimy mass of herbs. Bring this and the hot water and the candle into the room. I am going for some copal. She entered the room soon after and proceeded to light a candle and burn the copal incense. Her patient was quiet and still on the bed. She was very pale, but still conscious. Another woman was busy replacing bloody pads and sheets with new ones. Maria knelt down and gently began to pack the new mother's birth canal with about half of her herbal poultice. Then she sat back and resumed praying, holding the hand of her patient and whispering prayers over her wrist. We waited. After about 3 minutes, blood began to seep out again. Maria gently removed the poultice and wrapped it in a cloth to hand to the other woman. She then packed the rest of the poultice in the woman's vagina. She called for a spoon, then gently fed the remaining liquid in the mortar to her patient. We waited. After 5 minutes, the patient's breathing calmed and deepened. After 5 more minutes, there was still no more seepage. The whole room took a collective sigh of relief. The herbs she used in the poultice? A local lichen, blackberry root, rose petals, and marijuana. Antiseptic, analgesic, calming, absorbent, and most of all, styptic. And copal incense to cleanse the room of malaspiritos and infectious germs. It worked. Her patient healed with no infection and was up and caring for her new infant within 3 weeks. So I spent a lot of my time traveling around the world and learning about herbs and other types of holistic healing. And I did start a holistic healing center in Boonville, the Caretaker's Garden, where I practiced massage therapy and herbology, and we made lots of medicines and had a huge apothecary. And I did a lot of counseling and shamanic healing and other things like that. kind of a mixed bag, a GP, if you will, for my community. And my community is the Emerald Triangle. And so I was immersed in marijuana from the time I moved here in 1994 until the present day. So I've done everything from grow it to make the medicines, to work with people, to learn how to use it as medicine. Even back before we even knew it was this medicinal. Way back when, before all those growers had any idea about the endocannabinoid system or all the other chemicals in marijuana besides the THC. So it's been a long and amazing and magical journey with the plant. And I've taught all over the world, really, and tremendously all over the Emerald Triangle. And eventually I started to put all that together, and I did come out with a book. And you all can take one of these and hand it along. The book's going to be published next year. It's called The Emerald Trinity. And I'm just going to do a little shameless self-promotion and tell you about what's in it, and then we'll move on, and I'm going to talk about how to use cannabis to prevent and treat COVID. So the book itself, of course, has a chapter discussing and explaining the endocannabinoid system, which I'm sure we've all heard of at this point in time and know what's going on in the cannabinoids, so we won't go there. It does have a lot of my case studies in it, so that's kind of a nice way to learn about the herb. There's a chapter on it, and there's a big emphasis in the book on the spiritual uses of cannabis. So I'm a holistic healer, which means when somebody comes to me, I find out all about them, all about their challenges, their physical challenges, their mental challenges, their emotional challenges, and also what their spiritual practice is like. So, like a holistic healer, cannabis is also a holistic healer. We know it works on the physical level. We've all heard about that by this point in time. It's also excellent for mental illnesses, which I have a chapter on in the book. And it is also an ancient and important sacrament that people have been using since the beginning of time to commune spiritually with the divine. And so I'll finish my presentation talking a little bit about that. Also within the book, there's a lot of information that isn't really well known. I talk a lot about whole plant medicine, which means that all of the chemicals in marijuana, there's over 500 chemicals in marijuana, and they tend to work best together as a team. They don't work well when you just pull one chemical out like THC or CBD and try to use that. It's like having a quarterback with no receiver. You know, all these things really intermix and work together. So there's a lot of information about that in the book, including a lot of information about the medicine and the roots of cannabis, which is not something you hear a lot about. But the roots of cannabis have a lot of medicine in them that don't exist in other parts of the plant, including alkaloids and other things. And if we have time at the end, I'll go through a little bit of that. But those of you that are growers and have access to roots, you might want to start saving them, and they're very easy to process. You can chop them into, make sure they're clean, chop them into small pieces and dry them, and then you can use them in tea, or you can make tinctures out of them, or use them in other simple ways. So just keep in mind that there's a lot of things out there that mainstream hasn't really discovered about the plant yet. So there's a whole chapter on the different body systems and how cannabis interacts with each different body system, and also all of the different conditions that people have and how to use cannabis for them. That includes all the physical conditions. It also includes all the mental and spiritual conditions. Once again, with an overall look at people's health, and there's some really cutting-edge information about how to use it for Alzheimer's disease, cancers, and a lot of other things like that. So the first part of the book is basics for people that maybe don't know a lot about marijuana and are just starting to learn. The second part of the book is designed more for practitioners or people that know enough about marijuana that they're ready to design a marijuana treatment plan for themselves. Because, like all herbs, marijuana works better in a team with a lot of other herbs. Herbs work better in formula than they do singularly. So there's a lot of discussion about that, how to use other herbs with marijuana, and how to develop a dynamic plan, how to try something, measure the results, see if that works, adjust what you're doing, how to incorporate all the chemicals that are in marijuana together, even if they're not all together in one medicine, and dosing, and what to do if you overdose, and those kinds of things. That those are all very helpful if you're trying to treat something in yourself. There's a big chapter on how to make medicine with marijuana. So I'm a big fan of making your own medicine for 100 reasons. It's cheaper, you can put your own magic into it, you can make it in your own home. It's very, very simple. You don't need anything beyond what you probably already have in your kitchen. And I break it down very easily. I've been teaching people how to make medicine for about 20 years, and so you can learn how to make tinctures and teas and salves and even aromatherapy just for yourself. So you don't have, and all due respect to the dispensaries, but you know, if you need a lot of marijuana to work with a condition, you may not be able to afford to come down to a dispensary and buy that much of whatever that medicine is week after week after week, but you can probably afford to do it in your own home. So
Absolutely. Yes.
yeah. So I'm really a big fan of people learning to make their own medicine. And there's also a chapter on where you'll find cannabis in almost every single religion and spirituality in the world. You'll discover that it's actually the root of all of those religions and spiritualities if you look deep enough. And so that's one of my pets, my favorite ways to work with cannabis. And I do offer cannabis spiritual retreats. It was I was offering a program where people could become a cannabis therapy consultant, and doing the spiritual retreat was a big part of that. They would not get their certification unless they had some kind of spiritual relationship with the plant or an understanding of how their clients might form a spiritual relationship with the plant. And I will be offering one of those coming up on 4/20. April 20th at Wilbur Hot Springs with a good friend and colleague of mine named Grandfather White Wolf. So that's kind of fun. So what I'm going to do then is talk about the hot topic, which is COVID, right? And everybody here, I don't need to introduce the concept of COVID. We've all well, a lot of us have been through it at this point, or know somebody who's had. But I'm going to read part from the book that talks about COVID and the latest research. So, marijuana has over 550 medicinal chemicals, and many of them are known to be antiviral, including but not limited to the cannabinoids, cannabinoid acids, and terpenes. They work together in the immune system and prevent it from dysfunction. It's important to understand that cannabis medicine does not shut down the entire immune system like the currently used steroid therapies do. So often if someone's in a hospital, they'll give them very high doses of steroids because steroids are very anti-inflammatory, but the steroids interfere with the rest of the immune system. They basically, like a chemotherapy, will kind of destroy or suppress the immune system temporarily while you're using them. And cannabis doesn't do that. So it's a much better medicine for that kind of issue. So it alternatively, it actually promotes a healthy immune response and inhibits or blocks viral actions. So in addition to beefing up your immune system to fight the virus, it also affects the virus itself. So marijuana can inhibit or block viral actions including attachment, so it prevents the virus from attaching to cells. It prevents those spike proteins from forming. You've all heard about the COVID spike proteins. It will prevent the virus from forming those proteins. It prevents protease production, which I'll talk about in a little bit. It prevents the viral replication, so it slows the virus down from replicating itself. And it prevents viral gene expression, which means it keeps the virus from doing what it wants to do, as far as how it's going to attack the body. So cannabis medicine helps the body keep or retain interferon function, which is a very important immune function, and it prevents those inflammatory cytokine storms. Have you all heard about those? Yeah, where someone with COVID is so sick that their body overreacts and sends out a huge amount of cytokine storms, which cause mass inflammation and can actually lead to death. So cannabis mellows that out and helps prevent that from happening. It protects healthy tissue from viral infection, and it does this in cancer too. So I was talking about the proteases earlier. Sometimes when there's a cell that's been invaded with COVID or cancer or something like that, the cell starts to send out proteases, which are enzymes that break down proteins, proteases, and they do that to break down the healthy cells around it so they can spread. So the cancer wants to spread, so it breaks down the healthy cells around it so it can move in, and the same with COVID. So cannabis is a pretty unique ability to do that. Okay, and it's part of what happens with part of what happens with the COVID is it invades our blood vessels. We have inside our blood vessels an endothelial lining, which is like an inner skin, and the virus will infect that, and that's where we get the blood clots and a lot of other places. That's how the virus spreads throughout the body, and cannabis helps prevent that from happening. In addition, as far as symptom relief, marijuana acts as a bronchodilator. So if you have congested lungs and you inhale marijuana, vaporize it or inhale it, or even if you use it in another way, it won't happen as quickly or immediately. It will dilate the lungs and allow somebody to breathe. It's also an expectorant, which helps you cough up that. It breaks up any congestion in the lungs and help you cough it up. It's analgesic, which means it relieves pain, and COVID can be very painful with joint aches and everything else. It's anti-inflammatory. So it's going to help with the worst symptoms of the COVID that you're experiencing, while it's also holding the virus at bay. It also helps with nausea and vomiting, which if your GI tract is affected by the COVID, it's going to help with that, and diarrhea as well. So I've just got a couple studies here, and they're a little scientific. We'll break them down as we go. I think most of you are already on the same page here. So the coronavirus uses spike proteins on its coat to penetrate host cells. It kind of busts in that way. And the virus's favorite port of entry are these receptors called ACE2 receptors. You've probably read about them with COVID. These ACE2 receptors, which are ACE2 receptors. And those are found in all the mucous membranes in the lungs, the mouth, the nose, the kidneys, the testes, the GI tract, and most notably in the brain and in the endothelium or inner lining of our veins, arteries, and capillaries. Once the virus merges with a host cell, once it gets in there, it stimulates the release of those proteases that weaken the surrounding cell membranes, and it forces entry into those cells. It kind of hijacks the cell's DNA and makes the DNA replicate the virus. Makes the DNA of the healthy cells stop doing what it's supposed to be doing and start replicating the virus. That's how it can get going so fast. Because the virus can spread cell to cell, thereby avoiding antibodies and cruising through the bloodstream, it can hide from the immune system. So if it's going from cell to cell, from one cell to another, it's not even in the bloodstream. And most of our immune system operates on things in the bloodstream. That's where our antibodies get a hold of, antigens and take. So this virus can go from cell to cell and kind of hide from the immune system. So marijuana medicine prevents and treats COVID in a myriad of ways. Cannabis boosts the ECS, the endocannabinoid system, to prevent viral attachment by inhibiting the formation of the viral spike proteins, and it protects surrounding healthy cells by inhibiting those proteases. CBD has been shown to expose hidden infected cells to the immune system. So if the virus is hiding and there's viral cells, virus-infected cells that are hiding from the immune system, CBD can go in there and grab them and go, here it is, and expose them, again, to your own healthy immune system. It also can block viral replication, especially in those epithelial cells, in the mucosa membranes and the ones inside of our arteries and veins. It also inhibits the virus from causing damage, from expressing its genes. So cells that are treated with CBD retain all of these abilities even after the virus is gone. So once you've used CBD to treat your COVID, then the cells have gained knowledge about how to deal with COVID. And so they retain that knowledge, so if you're exposed again, they already know what to do and they're ready to take care of things. So patients that are already using CBD regularly, like some people are already using it for other conditions, they regularly show a lower incidence of infection upon exposure. Ding, 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 right? Keeping a low amount of CBD in your system at all times prevents you from getting COVID. The essential oils of cannabis. So we hear a lot in this industry about terpenes. Terpenes is like the cannabis industry. It was interesting. They just grabbed onto that one chemical and focused on it for a long time. Terpenes are amazing and very valuable, but they're only one tiny part of the essential oils of cannabis. So an essential oil are the oils in the plant. They're very volatile oils. You've heard about them, like lavender essential oil and those kinds of things. Plants that are smelly, plants that have a lot of aroma, those are the essential oils, and they're volatile. They break off and they go into the air so that you can smell them. Essential oils in general are extremely good at preventing disease. From ancient times, back in the days of castles and huts and shacks, people would put down what they called strewing herbs. They would strew herbs on the ground like rosemary, lavender, thyme, the really smelly ones. And for a while people thought, oh, that's just because it was so stinky back then. You know, nobody took baths, they were living with their animals, etc., etc. But in truth, when you inhale those aromas, they're killing respiratory pathogens. So they're actually acting at preventing the spread of disease. And so, for instance, we should have, this floor sprinkled with lavender and thyme all throughout. And I think, oh, those hospitals, those hospitals.
Could you imagine?
Yeah. So the essential oils of cannabis contain many anti-COVID terpenes. And when I say something is anti-COVID or anti-cancer, anti-this, it means that in a test tube, if you put cancer in this, it will kill the cancer. In a test tube, if you have COVID and this substance, it will kill the COVID. So many of these terpenes that are in the essential oils are anti-COVID specifically. Terpenes including beta-myrcene, alpha and beta-pinene, limonene, beta-oxamine, 1,8-cineol. There's a lot of those. But generally, if we could just say that generally, the essential oils of cannabis are anti-COVID. So simply inhaling your cannabis without smoking it, just simply smelling it, or any essential oil, is going to kill respiratory pathogens. So that's another way that cannabis can help prevent us. So when I ever travel or wherever I'm going, airplanes, airports, etc., places like this, I keep some essential oils dotted on my mask or dotted on the scarf or something like that, so that if I do inhale any pathogens, they'll be killed off by the essential oil. So don't go out of control, because a lot of people are very sensitive to scents. Keep the scent close to yourself so that only you can smell it, but keep it handy, whichever one you prefer. You know, if you like peppermint, lavender, it doesn't really much matter. They're all really good, but it's good to keep something near you when you're out and about. And dotting them on your mask just increases the value of that mask 100 times over. Or you can, alternatively, you can actually tuck a piece of an herb in your pocket or in the mask or whatever. I always have herbs in my pockets or my hats, and then you just rub them a little bit. And so keeping those near you. And there's, you know, you need to be careful with essential oils. You need to make sure they're diluted and that kind of thing. You can't put them directly on the skin. Many of them will burn. A little aside there. Learn a little bit about essential oils before you start playing with them, because you can actually burn your tissues. A lot of those cough drops, like Ricolas or Altoids, those are full of essential oils. So sucking on a cough drop is another way to prevent COVID. I'm a little bit off the cannabis thing, but we have not yet created a market for cannabis essential oil, and it's very, very expensive to make an essential oil because it takes a huge amount of plant matter and you have to distill it. And we have made, in many workshops, we have made cannabis essential oil, but there's no market for it, so you're not going to find it on the market, I don't think, at any time. But you can learn how to make the hydrosol at home, which is very easy. You just boil it in water and it becomes a steam. But anyway, you can go buy the little bottles of lavender essential oil and whatnot out there.
And all of those herbs are just as valuable as cannabis. I mean, cannabis has gotten a bad name over the years, but it's, you know, we talk about all herbs here.
Yes, yeah, all herbs, there we go.
So if you put cannabis like and you boil it and smell it, it'll help with the respiratory?
Absolutely. Just like if you did it with eucalyptus or
Does it have to
peppermint.
be decarbed?
No. These are essential oils, these are not cannabinoids that are doing this, so it doesn't have anything to do with that. Yeah. And you don't have to even put it in, you can just smell it, you know. But yeah, like making a steam from it.
Remember the old Vicks things?
Right. And Vicks works the same way, except Vicks is in a petroleum base,
Yeah.
so you kind of want to avoid that.
Not so nice.
Okay, so that's a big way that cannabis can prevent the virus and keep it from spreading. So if the virus invades the stomach, causing nausea, vomiting, diarrhea, or cramping or abdominal pain, so then we want to actually consume the cannabis if we can. So yes, inhaling it or smoking it or vaping will help, but we want to get the medicine to where the problem is. So I've found that the nicest way to get cannabis through the gut, especially for someone who's not used to imbibing it, is with tea. Cannabis makes a lovely tea. You know, you can blend it in, you don't need a bud, you can just use the leaves. You can blend it with your favorite tea flavor, a little peppermint or anything else. And you want to, if you can, add a little bit of oil or butter or milk or something fatty. It does pull more of the medicine out of the cannabis. It's not absolutely necessary, but a little coconut oil or something. And just sip on the tea, and you can sip on the tea very slowly. And so you have your choice of using a non-psychoactive form of marijuana, like very high CBD, low THC, if you want to just start there. Or you can, do a little bit higher amount of THC if you want to. Just being aware that when you consume marijuana that's been heated, like in a tea, it's 10 times as psychoactive as if you inhale it through smoke. So if you're heating up your THC and consuming it, it's 10 times more psychoactive than if you're using the THC in another way. And it's because it goes through the liver and gets broken down into metabolites that are much more psychoactive. So that's why, you eat the brownie, you eat too many brownies, right? Or you just have to be very careful when you're consuming THC that's been heated. If the THC has not been heated, it's not psychoactive because it's in an acidic form called THC acid. But so sipping on a little cannabis tea One of the herbs that I love to blend with cannabis for the GI tract, of course, is chamomile. It's an excellent herb for that. You want to avoid mints if vomiting is an issue. So mint will actually encourage vomiting. If you want to vomit, use a little bit of mint. It relaxes the sphincter between the stomach and the esophagus. It opens it up. So that's why mint will make you burp a little bit, or maybe burp out the other end a little bit. That's what it does. So if there's vomiting involved and you don't want to be vomiting, avoid the mint. But a little chamomile and cannabis tea is lovely for that. So one of the ways that COVID suppresses the immune system is by inhibiting interferon cytokines that signal the presence of infection and activate natural killer cells. So we have a immune system that it's a long chain of events, and the virus will get in there and mess up the events. So in this way, it's inhibiting the body from signaling itself that it's sick, and activating the immune system to come in and eat the infection. But CBD will upregulate that pathway. So the virus tries to destroy that pathway, and CBD protects it and makes it stronger. Again, the immune pathway. So if the virus infects the inner lining of that vascular system, the endothelial part of the vascular system of your veins and your arteries, then we have a lot of trouble. That endothelium inside the veins and arteries plays a huge role in regulating immune function and inflammatory equilibrium by preventing blood clots, keeping the vascular endothelial membranes toned and semi-permeable, and by keeping blood flow stable. So the virus can interrupt all of that. The virus can cause blood clots. It can mess up the tonicity of the mucous membranes, which prevents them from doing their job. They're very good at, they reabsorb things that need to be reabsorbed from the blood, and they keep things out that need to be kept out from the blood, and the virus gets in there and messes all that up. So this can lead to huge problems like blood clots, strokes, ischemic events, cytokine storms, which is the hyperinflammation, severe dysfunction of the entire immune system, including T lymphocytes, macrophages, interferon, and B lymphocytes. And those are the team that all work together to clear the virus out. So cannabis prevents the viral attachment and replication in your veins and arteries. So once again, it's preventing the virus from getting into the troubling areas. So one of the best ways to keep cannabis in your bloodstream versus the GI tract versus your head that I like to use is an alcohol tincture held under the tongue. So alcohol absorbs directly into the blood system. It doesn't have to go through your GI tract first. So by holding it under your tongue, it's going to get right into the blood system. So if you're dealing with an issue that's not in your gut or in your nervous system, then an alcohol tincture is one of my favorite ways to keep alcohol to keep it in the blood system. And we talked about the bronchial dilation, the expectorant, and the anti-inflammatory effects on lungs. In those cases, you would want to, if you can, be vaporizing or smoking or inhaling the cannabis. So that's the best way to get it to that area. Also, areas of the mouth, nose, throat, and lungs. So I do know a lot of regular pot smokers that have gotten COVID, right? And why? Because blah, blah, blah. You always wonder why. I don't know, of course, whether their cases were more or less severe than they would have been if they were pot smokers. We know if they were using CBD regularly that they were less likely to become infected. And we know that the use of cannabis during COVID helps with all of those symptoms. So I'm just going to touch briefly on the neurological effects of COVID. When I started doing this research, it was the part that really grabbed my attention. So a lot of viruses like the Spanish flu and the MERS, the Middle Eastern Respiratory Syndrome, and all those other viruses, the SARS, they actually cause a lot of neurological symptoms that you don't hear about or think about very much, including sleep disruption, extreme fatigue, moderate to severe headaches, drowsiness, coma, restlessness, and tremors. So COVID-19 came along and not only causes all of those things, but significantly increased the severity of all of those things. And it brought with it additional, more severe problems like delirium, altered taste and smell, which doesn't sound that bad, but I'll show you in a minute why it's a little bit of an issue. And a lot of long-lasting and or permanent neurological and psychiatric conditions, including strokes, brain hemorrhaging, brain damage, memory loss, inability to concentrate, psychosis, seizures, and Alzheimer's disease. So, one big review of over 236,000 COVID cases. This probably was from England. I have a lot of studies in here that came from other countries because they actually do studies. The NIH was not a bad one to follow for COVID. Anyway, after 6 months following hospitalization with COVID, they found that 84% of patients had at least one first ever diagnosis of a neurological or psychiatric disorder. So something that lasted past the infection. I'll just put a couple of them. So 85% had nerve disorders, 76% had strokes. This one, 67% of these patients, 6 months after infection, had their first ever diagnosis of dementia. So there's a lot of that going on. So the virus is getting into the brain and causing other things like psychosis, brain hemorrhaging, mood disorders. Parkinson's disease, I mean, it's low. About 11% of them had first diagnosis of Parkinson's disease. Encephalitis, anxiety disorders, you know, those are the lower ends. But yeah, the dementia thing really, you know, hit a nerve. Sorry. And this study also found that these neurological disorders occurred at a pretty high rate even for those that weren't hospitalized. So even for those that had mild to moderate symptoms. It's really getting in the nervous system. Often the neurological infection, when the virus infects the neurological system first. So before you have any breathing issues, before you have any gastrointestinal issues, those nerve disorders might come right on. And we know that if you have an altered taste of taste or smell, that's in your brain. So it means that COVID is in your brain. I'm not going to go through all these studies. That would be a little bit. There's a couple more. Okay, so I just wanted to explain how this happens. So the cognitive impairments, the impairments in your brain, aren't due to hypoxia. They're not due to lack of oxygen. Like, you know, they put people on breathing machines almost immediately because they're worried about oxygen to the brain. That's not what's causing this. What happens is when the virus is inhaled, the body sends in immune cells that release these inflammatory cytokines, and that they change the olfactory nerve cells, your nose, your smelling cells, and they prevent odor receptors from functioning. Even though the virus doesn't infect those neurons themselves, it uses them as a channel to enter the brain. So that's how it gets in there and starts to affect cognition and emotions. And once in there, those spike proteins help it break through. We have a blood-brain barrier, which is a barrier that keeps things out of the nervous system that shouldn't be there. And the spike proteins can bust right through it. Thank God cannabis can as well. In some cases, the post-mortem analysis have showed that the brains contain 1,000 times higher levels of the virus than other parts of the body. Inflammation in the brain, I mean, going on, it kills surrounding healthy cells in the brain, and on and on. So I'm not going to go through all of this, but I just want to say that keeping a small amount of cannabis in your system at all times will protect you from COVID getting into your brain or doing a huge amount of damage. So we know that cannabis crosses the blood-brain barrier. We know that it reduces inflammation in the brain. We know that it actually will untangle or prevent the tangling of the tau proteins, which is what some people think leads to Alzheimer's disease. So cannabis is very active in the brain. It's part of the reason why we love her, and part of the reason of how she's going to keep us healthy from COVID. So hopefully that wasn't too much of a downer. about COVID, but again, I'm just going to encourage you to keep a lot of cannabis, keep a small amount of cannabis in your system. Keep your ECS, your endocannabinoid system boosted.
Maybe while you're taking your drink of water, this is a good chance for me to offer, when you're done with this class, a free taste of the best CBD tincture in the country, in my opinion. This is what I give to all my patients. It's a very high ratio, 26-to-1 of CBD to THC and the other chemical compounds in there. No psychoactivity whatsoever, but it will reduce inflammation in your brain and in your body. And I'll give you a hit of it when we're done, if you want.
What's it called?
It's called CBD Mendo. This one's lemon. Organic lemon in a biodynamic grape alcohol base, which is the best because, talking about the blood-brain barrier, when you put a tincture on your tongue, excuse me a second, you put a tincture dose on your tongue and swish it around in your mouth, it goes through the oral mucosa and through the blood-brain barrier to get to the CB1 receptors, which are in the brain, and get into your body systemically. Oil-based tinctures, which are most of them because they're 25% of the cost of biodynamic grape alcohol, but if you look at the history of herbal medicine, doctors and herbalists down through the ages used alcohol as a medium to carry the medicine into the body because it sucks into the system real well. Oil has a tendency to separate from the medicine that it's carrying, so manufacturers will put in emulsifiers to get those molecules to adhere to each other. We don't want emulsifiers in our medicine. We want our medicine to be pure and potent. And passing through the blood-brain barrier with alcohol-based tinctures is the best. That's the best way to get into your system. Thank you.
Unless you want to get it into your digestive system.
Well, then that's a whole other story.
If you want to get it in your digestive system, yeah. So it just depends on where you want it to go.
Yeah.
But other than that, that's absolutely. Thank you for that.
Sure. Thank you.
Are we doing okay on time?
We're okay. I mean, I would, you're close to the
About
end.
20 minutes?
Yeah, sure.
Yeah, I want to talk about the spiritual part.
The spiritual part, but that would be a great intro for Dr. Miller to walk in on.
Okay, all right. Okay. So we know that cannabis and hemp is just woven so tightly into the fabric of humanity since the beginning of time, and we've co-evolved together. And we know that, all of the world's cultures, almost all of the world's cultures have used cannabis as food or fiber or medicine. But what a lot of us aren't aware of is that almost all of those cultures also use cannabis spiritually. So very few of today's Christians are aware that Jesus used cannabis. Very few of the Jews know that Moses used cannabis. Very few of the Buddhists know that Buddha used cannabis. Very few of the Muslims know that their Zoroastrian roots and the Zarathrustras are all involved around cannabis. Hinduism, Taoism, and many other of these spiritualities, if you look deep enough, have cannabis at their root, including the thousands of shamanistic cultures in Africa, Asia, and Europe. So, I really found in my research that the history of cannabis is really the history of also humankind in all of their religions. So from the beginning, we helped people evolve into spiritual beings back before we were aware of the other. There's a historian, a cannabis historian named Richard Schultz, and he is the author of Man and Marijuana. And he also is a co-author with Albert Hoffman of Plants of the Gods, The Origins of Hallucinogenic Use. And this is a little quote from him. In his quest for seeds and oil, he certainly ate the sticky tops of the plant. Upon eating hemp, the euphoric, ecstatic, and hallucinatory aspects may have introduced man to the otherworldly plane from which emerged religious beliefs, perhaps even the concept of deity. The plant became accepted as a special gift of the gods, a sacred medium for communion with the spiritual world, and as such, it has remained in some cultures to the present. So we go way back to the early races, and almost all early tribes, before there were shamans, before there was a specialization in tribes where one became a shaman, all people communed with the spirits around them and the divine. And we use a term, entheogens now. It's a newer term to cover the plants and the funguses and the animals that help us commune with the divine. It technically means, entheogen means to generate the divine within, or to engender the God within. It's talking about that you are the God, and I'm here to help you realize that, basically. So these psychoactive, or what I like to call spirit-activating plants and substances, are the source, basically, of all religions and spiritualities. It's how people first were able to commune. One of the first ways that people did this was with incense. So I think everybody here has probably sat around a campfire once in their life, you know. And what do you do when you're sitting around a campfire and you're just staring at the flames, and pretty soon you find yourself just kind of picking something up and throwing it in the fire, you know, seeing how it goes. And pretty soon you're picking up stuff and realizing that, oh, each thing I throw in there has a slightly different flame, a slightly different smoke. So if you have been dragging plants, seeds, and food that you've gathered into your campsite's going to be covered with that, you know, after a while. So pretty soon you're going to be picking up pieces of cannabis and throwing them in there and noticing, oh, that's a pretty sweet smoke. And oh, after I inhale that smoke, I'm in a little different state. And oh, yeah, that's how they started to discover what's going on. So that was really the first incense. And I think cannabis was the first incense that human beings ever used. So there's some ancient archaeological evidence of this. All this happened long before there was history and long before we could find archaeological evidence. But there was a culture called the Serendi Stog culture, and this was known to be around 4500 BC. And they lived in like the Kazakhstan area, the Ukraine, the steppes of the Ural Mountains in western Russia, since about 35,000 BC, which is a really long time. The Upper Paleolithic, or the Stone Age, basically, we're talking about Stone Age people. And they found there a lot of drinking vessels that were decorated with hemp cord. So they wrapped the cord around the vessel when it was wet and pulled it off, and there was an impression. And so people believe, or the scientists believe that, well, that indicates that they were probably drinking hemp tea. You know, so even way back then, they were drinking cannabis tea. This same culture, the Serendi Stog, also were the first to, they were the first to domesticate horses. And of course, how can you domesticate a horse if you don't have rope, right? If you don't have lines. And so they were able to turn their hemp into cordage and capture some horses, domesticate the horses. And so this is an ancient culture, and they spoke a language called Vedic, and they were called Aryans, right, way back then. And they slowly evolved into the Scythian tribes that were still in that area. And the Scythian tribes, they took their horses and they took their hemp, and they just went nomadic, and they just dispersed. They went galloping out of those mountains in all directions. They went into Siberia, Bulgaria, Persia, which was Iran. They eventually made it to the Hindu Kush mountains of Afghanistan. They were in India. And when they reached India, and so as they were going out and about and conquering, they were great conquerors. Some of them would settle in and become farmers, and some of them would stay nomadic. But in India, when they got there, that's where the language Sanskrit evolved, and that's where the Vedic texts were born. And the Vedic texts are the oldest religious texts known to man. So it's basically the oldest religion known to man. Although, as with any text at that time, it's accumulation of a lot of ancient oral history and oral religion. So this has been going on for a very long time. The Scythians, they were named for the scythes that they used to harvest their hemp. So they were the ones responsible for spreading it out and about. And I think when they were running around with their cups of tea and their pottery, well, if you're on horseback camping and fully nomadic, it's a little hard to carry all that pottery around. So they developed another method. They would get to their campsite and they would take 3 sticks and make a teepee, and they would cover it with the felted wool of their animals. And they would put a brazier inside, which is a little campfire with coals on it. And they would throw their seeds in there. And then they would crawl in there and hotbox their tent and get stoned and had a lovely time. And sometimes they didn't even bother to build a full-size teepee. They would just build one big enough that they could get their head in there and lie down on the ground and inhale their cannabis. So this is the root of a lot of religions. So they brought cannabis in the form of soma. They called it soma to India, and that's where the Vedic religion developed. So it's the oldest known religion. The oldest religious texts are the Vedas, and the Vedas are completely dedicated to soma. So soma was described as a plant, as a beverage, and as a god, right? So soma represented all of that. And there was a sister religion that developed in Persia, the Zoroastrian religion, and they, instead of calling it soma, they called it homa, but it was also based on cannabis. The Persian priests were called magi, and where have we heard of that before, right? The magi that brought gifts to the new baby Jesus. And what gifts did they bring but incense, right? So they got out and about. And their prophet, Zoroaster, was conceived through the use of soma. And here is how it was written in their text. A heavenly rain brought forth cannabis plants, which were consumed by cows, and which were consumed by the cows of his earthly parents. The cows gave milk, which was pressed with cannabis and drunk by the prophet's parents, who later conceived him while making love for the first time. So that's the basis of that religion. So the recipe of soma was lost, and debated for millennia. People just argued over it. All the archaeologists think, what was soma? It created these 2 religions. What the heck was it? Well, they finally figured it out because they discovered a temple in the area where Iran, Afghanistan, and Turkmenistan kind of meet. They discovered this ancient temple, which was actually a huge field of buildings. And they went to the inner temple. And inside the inner temple, where the magic happened and the religious rites happened and the priests did their things, there were some giant tubs, and the tubs were lined with calcium carbonate, lime, they were made out of that. And they were able to scrape some of that out and find out what was in the soma, because that's what they were making in those tubs. And what they found were that the soma was made out of poppies, ephedra, and cannabis. So now we know where this ancient thing of sound was. And then they went out and looked in the fields around where they had been researching the temple, and they found poppies, ephedra, and cannabis growing, out there millennia later. I mean, so much longer later. And ephedra, if you don't know, is it's an Asian herb, and it's a lung herb, but it's also a stimulant. So there they were having the poppies, you know, the happy poppy opium thing, a little bit of ephedra to keep you up chanting all night, and your cannabis. And we used to make that in our
You sell that, Judy?
But we're planning on it right now.
yeah, we used to make it in my weekend workshops. It was amazing. So what I can close with this, or I can do a little bit more. Stuart, are you ready to close?
Close with this, yeah.
Okay. I'm going to close with this. This is, so the Vedas were 4 different texts. The first text is called the Rig Veda. It's the oldest religious text on the earth. It had 114 hymns in it. They called them mandalas. And every one was devoted to Soma. And I picked one out to read to you today because I thought you might feel this. Some other time I'll tell you about where cannabis is in the Bible. It's all over the Bible. Okay.
Is it your book?
Of course. Okay. So I'm going to take a deep breath. And I'm going to read you this prayer. Sanctify, Soma, our mind, our heart, our intellect. And may thy worshippers delight in thy friendship, like cattle in fresh pasture, in thine exhilaration by the sacrificial food, for thou art mighty. Like the winds violently shaking the trees, the droughts of Soma have lifted me up, for I have often drunk of the Soma. The praise of the pious has come to me like a lowing cow to her beloved calf, for I have often drunk of the Soma. Both heaven and earth are not equal to one half of me, for I have often drunk of the Soma. I am the sun, the greatest of the great, raised to the firmament, for I have often drunk of the Soma. Soma is a sage and a seer inspired by poetry. She clothes the naked and heals all who are sick. The lame walk, the blind see. Soma is a sure means of attaining divine wisdom. It releases us from anxiety. It is the sorcerer's ceremonial fire. We have drunk Soma and become immortal. We have attained the light the gods discovered. Soma is the elixir of eternal life, the source of happiness and the reliever of suffering. Soma was obtained by men on earth through their desire for the welfare of all people. To those who regularly use it, it begets joy and destroys every anxiety. Soma is the god for gods.
Thank you, Wendy.
All right. Thank you for joining me.
Now, special treat. I've been taking this all day. This is how you take it. You take a little bit on your tongue, swish like crazy before you swallow. It's pure CBD.
Can I just interrupt?
Oh yeah,
Take a little bit and put it on your hand, and then lick it off your hand.
that's another way to do it. Yeah.
That's better in a group. For sure.
Well, this is how I usually do this after my classes. No psychoactivity. You're not going to get high from this. I promise you.
Too bad.
I've been taking it. Too bad. Sorry, but it's great for inflammation. Reduces inflammation. So this is the way we're going to do it. I ask you to, if you want it, tip your head back so that it doesn't dribble down your. That'll be a waste. It dribbles down your chin. I'll put it on your tongue and you close your mouth and swish, 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 swish like crazy. And before you swallow. And this is biodynamic grade alcohol and organic Meyer lemon. So I think it's great. Some people think, whew, a little too hot for me. So, but it's, you don't let it sit in your mouth. You swish. So like this.